I have actinic keratoses, which are pre-skin cancers. They can become, at a certain point, basal cells or squamous cell carcinomas. So we do a treatment here in the office called Blue Light, and it will help treat those actinic keratoses, and it can help prevent future basal cell and squamous cell carcinomas of the face, neck, and chest, and hands, which is helpful so that maybe we don't have to do Mohs in the future.
So the steps in doing this ALA blue light is we'll first clean her face. The skin is actually cleaned with soap and water first, and then acetone. Acetone is to decrease the skin to make sure all the surface oils are removed. We will apply the Levulon stick. So ALA stands for aminolevulonic acid. Actinic keratoses are precancers. Often this procedure is best when people have several small precancers, small or large precancers scattered on their face. What actinic keratoses look like, they're actually harder to see. They're easier to feel. So you may or may not be able to see them on Kerry, but she could certainly feel them. So if you touch, for example, right in this area, it feels like a little sandpaper-ish patch, and that's two actinic keratoses right next to each other. You could see a little rough patch here on the left cheek, and if you feel it, it just feels like sandpaper, whereas over here it's smooth. And lots of people think they just have dry skin or eczema or something like that, when really it's this actinic change or actinic keratoses. And we can treat that. We can completely remove it by doing these procedures called the ALA blue light. This part of the procedure is what activates the aminolevulonic acid. That part does burn, sting during the procedure. After it's done, we cool the skin with water and some cooling gels, and the patient has to stay out of the sun for 48 hours. They can't get any sun at all. It generally takes about 5 days to a week to completely heal.
Okay, so I just wanted to touch base. It has gotten a little redder since I started. It feels just like kind of a bad sunburn. Totally normal response. I'm gonna just relax, no sun for 48 hours, and I should get a really good result. So there it is. So guys, I did the blue light on Friday, and it is Sunday afternoon right now. I feel really tight in through here, like I'm gonna start peeling. It's a little itchy, but pretty good. I think this product saved me. I also thoroughly enjoyed washing my face with this product. It's the Aven Zero Calm Cleansing Oil. Felt really good. Got my face really clean. Okay guys, so it's Monday morning. I'm peeling a lot here. Just feels tight. It's itchy. It's frustrating. Don't like to look like this. Don't like to feel like this, but I know it's important. So there's a good look for you guys. Okay guys, so it's Tuesday. I did the procedure on Friday. It's almost comical how bad I look. Let's have a good close look at that. Ugh. Wah. I can't wait for the after pictures. So this morning, let's see, it's Wednesday morning, and I woke up. I started to do this, but then I was like, oh, I should do this for everybody on my YouTube video. You guys have no idea how challenging it is to be a YouTube star, YouTube sensation. I'm just gonna blow up the internet. Okay, so I have all these peels on my face, and what I'm doing right now is I'm getting some hot water and a face cloth, and I'm just gonna like gently rub my face where I'm peeling. So it seems the last part of the peel is on my forehead. Gently. But I did this yesterday and I didn't show you guys, but I look so much better. And I was able to cover it up a little bit with the Alcom. So, you know, there's a bunch of peel on my face cloth. Just rubbing it. Yeah, I'm going to do it one more time. Little product endorsement. Okay. And you guys, I know I look pretty nasty, but this skin that has peeled off, and underneath that skin that's peeled off, like right here, oh my gosh, my skin has never felt softer. And I know I still have all these red spots. Those will subside, and I'm super excited. I think I got a really good result. So after that, I can pat dry, and then I'm gonna use this one again. I love this stuff. This has saved me, okay? So I just put all that on, and I'm just gonna literally saturate my face with this stuff. Feels good. All right. And I'm sure, I did my chest too. Getting it done. New year, new Kerry. All right, guys, that's it for now.
So we're 3 weeks after Kerry's ALA blue light procedure, and I just examined her face. You could see now that where she had some actinic keratoses in this area and down here, they're completely gone. Now her skin feels completely smooth. She doesn't have any more of those sandpaper-like rough spots that are precancers. So generally after this procedure, if we've treated one area, a patient can expect about an 80% reduction in precancers for the next 5 years after the procedure. So it doesn't mean that she'll get 0 precancers, but she should have, you know, smoother skin and less of a chance of skin cancer for at least that period of time. Kerry was just asking me about other spots on her face, little red spots or little sunspots. The blue light procedure sometimes does also give a cosmetic improvement as well as an improvement in precancers, but sometimes there are other spots that, you know, don't go away that the patient would like to treat. So if we'd like to treat this redness here, we could do our vascular laser or optimized pulse light treatment to this area and this area. And for little brown spots, there's other laser procedures we could do to tighten the pores or other things. But Kerry got a good result from her ALA blue light procedure, and the next most important thing is sun protection every day with a good sunscreen every morning, and regular skin exams at least twice a year to catch any of these things early if things do pop up.
Okay, so I'm discussing like my protocol that I used post-procedure after my blue light treatment with a patient. She's in a unique situation because she has an allergy to Aquaphor. So Aquaphor is usually what we recommend for most patients. I personally dislike Aquaphor, that feeling of that thickness and that just greasiness, and it gets all in your hair, and I just don't like it. So I tried to avoid it after my blue light procedure. When I left, I used this Stratamed. It's safe to use immediately post-procedure. I used it all over my face, and you only have to do it twice a day, which is kind of nice. All right, after you let this dry on your face, you can use the Cyclophat to calm and just to relieve the heat and the kind of discomfort that you might be feeling, and it also feels a little bit moisturizing. Okay, when that night after my blue light procedure, I cleansed with this cleansing oil, which was very soothing, and it was nice to kind of have all the gook off my face. It didn't hurt at all, didn't sting, and I would highly recommend this. I use this throughout my recovery. So cleanse with this, then I would use this twice a day for the first 3 or 4 days, and I would follow with the Cyclophate, okay? And then later, once I stopped using this after day 3, I was using just these 2 things. In fact, I'm 1 week out from doing the procedure, and I used this after I washed my face this morning. I let it sit for a few minutes, and then I put the Zero Calm Balm on, okay? And so I really wouldn't want to do the recovery without any of these things. This one is more of like, just helps you to heal faster. Doesn't really feel good, doesn't really give you any relief, but these ones were very calming, and I was grateful to have them.